think that a really great clinical instructor would be an instructor that would use their expertise in the nursing process to come into a setting and first assess what that setting has to offer and who the players are in that setting and what are the needs and unmet needs of that setting, and try to incorporate what the plan is for the students and incorporate it. So I think probably the rapport building is the most essential part in the very beginning.
They find out exactly what's up with those kids that they're going to be assigned to. They ask me exactly what their routine is. They try not to break the normal routine. Mainly they're prepared. They ask a lot. They have to be able to discipline the students without scaring the life out of them at the same time. But there should be repercussions for your actions. It's definitely a fundamental thing, you know, about nursing. You know, it needs to be instilled as a student. It's not just you. You know, you're part of a team, you know, and it's such a difference when people come into it as new nurses with that approach. You know, that you have to pick up where the other nurse left off. Because nursing is a team thing. This is a 24-hour-a-day job. You know, I clock out at 3:15, but the responsibility goes on. You know, and I think an instructor needs to make sure that the students are aware of that.
Sometimes the instructors come in with a large group, like 8 people, and when they treat them like they're a family and they kind of keep them all, herd them together and have little huddles before the assignments, I consider that helpful. I think when they come during hours and speak with the assigned nurses' preceptors and review their progress, I consider that helpful. I think when they have a printed handout of what their guidelines are and what they need to accomplish, that is helpful. One other thing that I thought was helpful is sometimes you have students that don't have the appropriate motivation or attitude to be successful in their clinicals. I expect that to be addressed immediately, and the clinical educators that were made aware of this, that immediately took care of this problem and made that student aware of what the repercussions are of their behavior, I found that very helpful. Okay, the clinical educator instructor is dependent on having good people to work with them. So knowing who those strong people are, having them educated and oriented with packets that are given to them of what their expectations are, I consider that essential. Frequent visits, at least once a week, with the clinical instructor is crucial.
They are continually informing us of what they're doing with the students. They have keep us up to date as to where they're going to be and what their plans are for that day. They tell us which patient they'll have and when to expect them back and who's going to have them. They report off, teach the students to report off with us so that we can stay up to date.
Many times the CI and the students would sit back and have conversations after our blood pressure checks and health education classes were over. So they would communicate about what they did and how they can make it better the next time.